guest, Dr. Rizwana. Karibu sana.
Asante.
It's very nice to have you in studio. But please tell us about Lions and what your mandate is and what you do in Kenya.
Okay, so the Lions Side First Eye Hospital, now a 26-year-old facility, started with the mandate of giving back the gift of sight. So this is what we started as a facility where we wanted to make sure that we participate and ensure that anything that is avoidable in terms of blindness can be done. And this is generally one of the biggest things, especially with cataracts. People think that they've gone blind, yet it's an avoidable blindness. So that's the ethos, giving back the gift of sight, treating and preventing blindness.
I want to get to know a little bit about the work you're doing, but beginning with what are the most common challenges that you interact with, and especially the ones that are easily avoidable or easily treatable that people may overlook or think are very serious, like the cataracts you mentioned. Yeah.
Right. So basically, the Lions Side First Eye Hospital is a comprehensive one-stop eye care hospital where we treat all forms of eye ailment. However, the common things and which people should really take care of is probably regular checkups. If you have itchy eyes, you need to take care of them early so that you don't rub too much and damage your eye further, because it can, when your tear ducts stop producing well, they will create more problems later on with your cornea, etc. So that's one of the things that we work with. The other thing is, people sometimes don't want to wear glasses, yet you find that you've got a condition where it's a refractive error, you need glasses. And what we find is these are some simple basic things that you need to look at, and regular eye checkups, especially with the amount of technology that we're using, especially in our current times and going forward with AI and everything.
Yes.
We know we are going to be surrounded by technology. So taking care of your eyes, good eye checkups, frequently blinking when you're using technology all the time.
Yes.
And these are some of the common things that we face. But besides that, the common conditions that we look at are cataracts. Cataracts is one of the most easily reversible of blindness. This is generally something that human beings acquire as we age. As you age, your God-given lens tends to become opaque and needs a replacement. So cataract surgery can give you back the gift of sight. In fact, one of the experiences I can tell you, there was a diabetic patient. In diabetes, it comes along early. But when this patient got a new lens fitted, he said, I can see tomorrow.
Oh, wow, I love that.
So you know what I mean?
Yeah.
This is the impact of taking care of your eyes. And just from a general holistic healthcare perspective,
Yes, and the quality of life.
yeah,
Yes.
80% of what your brain perceives is from the eyes.
Okay.
So it's what you see is what your brain now translates into messaging and how you're going to behave or learn. The other 20%, of course, comes from the ears and the other senses.
And the other senses, yeah.
So we have to take care of the 80%.
We really do. I mean, there's also quite a big challenge sometimes when it comes to healthcare and quality healthcare. I've seen like several threads on Twitter, talking about this could have been avoidable. My dad had glaucoma, but the doctor didn't tell me that it's hereditary. So, if I'm pregnant, I need to do this and that. Or I went and I was misdiagnosed. Please tell us about the kind of quality that Lions Sight First Eye Hospital offers.
Okay, so our focus is on quality right from the inset. So we normally, whenever a patient presents, we will of course look at your visual acuity to see whether you're able to see distance or not and things like that. But we have also introduced the measurement of eye pressure. Eye pressure is one of the first yardsticks to gauge whether you're going to be a person who may have glaucoma, etc. So these are some of the basic things that we do right at the onset, because we want to be sure that we try and trap them. The hospital also has a fully fledged diagnostic setup, so we are able to do all sorts of diagnosis on the eye. The eye is divided into two. There is the front of the eye and the back of the eye. So the front of the eye is what we perceive, what we see. The back of the eye is the one that translates the messages, sending them through the nerve into the brain. So we do a comprehensive check, and we make sure, in fact, because we're a multidisciplinary hospital with all specialization, right from simple ophthalmologists to glaucoma specialists to retina specialists to cornea specialists, what happens is when you come in for a screening, our doctors will check your eye, and if they see anything that is doubtful, they will immediately refer you to the specialist. So the advantage of that quality is it's multidisciplinary, it's one stop, and we make sure that we try and trap it as early as possible so that the management can be easy and you can live that quality of life.
That you, yeah,